CT scan is a painless, non-invasive, and accurate diagnostic test that uses X-rays and computers to create 3D images of the body. Unlike other forms of medical imaging, such as X-rays that can only create 2D images, CT scan can make an image of every type of body structure at once, including bone, blood vessels, and soft tissues. Doctors may recommend CT scan for blood clot, broken bones, cancerous tumors, infections, internal injuries like bleeding, or cardiovascular disease. During CT scan, patient lies on a table that slowly passes through the tunnel. As the patient moves through the tunnel, a giant ring, called gantry, rotates around the body. The gantry contains X-ray tube that emits a high-energy electromagnetic beam as it moves through an arc. This beam casts a shadow onto X-ray detectors, which can measure the amount of radiation absorbed by the body from different angles. The detector relays the information to a computer that will create thin cross-sectional images of the bones and soft tissues through the shadow cast by varying tissue densities. These image slices are called tomograms, and since the computer makes the slices, each picture is called computed tomogram, hence known as CT scan. Sometimes CT involves the use of a contrast agent or a dye, such as iodine and barium. The dye may be given by mouth, injected into a vein, or given by enema before the procedure. The contrast dye highlights specific areas inside the body, resulting in clearer pictures. The CT scan allows the doctor to see the location of the condition inside the body, which can help them decide appropriate treatments or to monitor the progress of the treatment. CT scan of whole body can create pictures of nearly every area of the body, from the chin to below the hips. This procedure, which is used routinely in cancer patients, can also be used in people who do not exhibit symptoms of the disease. These patients are known to be asymptomatic. Studies have shown that CT can be effective in both ovarian and lung cancer screening, which exhibit features of being asymptomatic. CT scan in cancer can detect abnormal growths, as can be seen in the image on the left, which clearly depicts the growth of ovarian cancer, and to determine whether a cancer is responding to a treatment, as can be seen in the image on the right, which doesn't show any growth of cancer after olaparib treatment. It can also be used to help diagnose the presence of a tumor, provide information about the stage of a cancer, determine exactly where to perform a biopsy procedure, detect recurrence of a tumor, and guide certain local treatments, such as the implementation of radioactive seeds.
The use of several layers of images allows for finer details to be seen. This is particularly important in the diagnosis of various cancers, in particularly asymptomatic lung cancers. In early stages, cancers may exist as growths less than 5 mm in size, which cannot be picked up by certain techniques such as X-ray imaging. However, the detail that CT scanning provides makes it easy to detect cancers at an earlier stage when they are much smaller in growth. Meet Sue Schiffler. She was a pack-a-day smoker for 30 years. 10 years after she stopped smoking, she was contacted by the Mayo Clinic located in Minnesota, United States, to compare X-ray imaging and CT scanning of high-risk patients. And the results?
Revealed a small cancer.
This was a study with the CT scanners to see if early detection of lung cancer can save lives.
Dr. Stephen Swenson and Dr. David Midtune were investigators in the study, which compared screening for lung cancer in high-risk patients with X-rays versus CT scans.
That it showed actual lives were saved, mortality reduction. Fewer people died of lung cancer who got CT screening than got chest X-rays.
As David Midtune says, it really does have the capacity to save lives. Early detection in cancer is of vital importance, as some cancers can be quite aggressive in terms of their quick growth, such as lung and breast cancer. This is furthermore significant to asymptomatic patients, as unlike regular cancers, the patient is unlikely to encounter symptoms at an earlier stage, and they often encounter symptoms at a later stage where the cancer is rendered inoperable or incurable. Statistics listed from the Australian government estimated that around 1/3 of cancer patients will die within a 5-year period after being diagnosed or having fought off cancer. This leads to a 1 in 3 fatality rate across lung, breast and prostate cancer. Cancers in Australia are often diagnosed utilising localised CT scanning or X-ray imaging techniques. However, as stated previously, X-ray imaging detects cancers at much later stages. So statistically, if patients are diagnosed at an earlier stage and treated, the mortality rate would see a decrease. The study conducted by the Mayo Clinic also singled out high-risk patients, which refers to people who smoke, are overweight, or have had family history of the disease. High-risk patients, as the name suggests, are more likely to develop the cancer. They are often aware of the risk and therefore have regular checkups. The CT scans will detect at an earlier stage and could reduce the fatalities of high-risk patients. This is becoming increasingly more important as, according to the Australian government, it seems that there are more incidences correlating with the increase of high-risk factors such as obesity. However significant CT proves in saving lives, CT scan does have some concerns.
Whole body CT screening in asymptomatic cancer patients has raised great concern over the past few years. This procedure was quite commonly used during the late 90s to early 2000s. Now it is restricted in many countries like USA and Australia. The CT scan generates the high dose of powerful radiation than other medical imaging modalities such as X-ray and mammogram. As a result of high associated risk, there is more cons than the pro in regards to this technique. The main positive of CT scan evolved around the fact that it has high capacity to diagnose the cancer patient at an earlier stage with relevant sign, genetic history or risk factor. The targeted CT screening, such as lung cancer screening using the low-dose CT, has shown some effectiveness in the detection of asymptomatic lung cancer. It is used in people with high lung cancer risk, such as long-time smoker, miners and other industrial workers who have been exposed to the highly radioactive materials such as coal and uranium, and people with the lung cancer family history. The low-dose CT exposed the patient with less radiation, less than 10 mSv. Low-dose CT is capable of generating the image with detailed structure of lungs tissue such as bronchioles. This gives its capacity to effectively detect every nodule in the lungs. According to the Radiological Society of America, the low-dose CT screening is the most effective screening program for asymptomatic cancer patients, and it is proven to detect the cancerous tissue at earlier in the treatable stage, which in turn has reduced the cancer death rate by 20%. The main drawback of whole-body CT scan concerns that it generates the high dose of radiation than other imaging modalities. The whole-body CT scan exposes relatively high amount of ionizing radiation, as estimated around 12 to 20 mSv, which is 4 times higher than the average annual dose of radiation obtained from natural sources such as soils and rocks, which would increase the potential risk of developing a cancer. One whole-body CT scan at the age of 45 can increase the cancer development risk by 1 in 1200 chance. If the same person gets the same scan every year until age 75, the cancer risk goes up to 1 in 50 chance. It is worse for children. One whole body CT scan at the age of 15 can double the risk of developing leukemia, brain tumor and other forms of cancer, as children's bodies are still growing and sensitive to the powerful radiation. In addition, there is no sufficient evidence stating that the whole body CT screening is effective for all cancer detection, as most benefits are seen in the people with a specific asymptomatic cancer such as lung cancer. Finally, there is a high possibility of false positive results such as mistaken cyst for the cancerous tumor, which lead to misdiagnosis and require unnecessary future investigation that may require more resources.
CT scanning can be a life-saving tool for diagnosing cancers at an earlier stage and will greatly lower the mortality rate. It is proven to give chances to those most at risk, like Sue Schiffler, who was diagnosed with asymptomatic lung cancer at an early stage. However, full-body CT scanning presents a higher level of radiation that may prove to induce disease rather than help eradicate a potential case. It has also proven to be inaccurate in circumstances giving false positive results, such as mistaken benign or hemorrhagic cysts for a cancer. We support the view of the American College of Radiology and International Radiation Protection Advisory Council, who do not recommend nor endorse the use of whole-body CT screening in asymptomatic cancer patients.